Hello, you are listening to Trump Republic Radio. It is September 14th, 2017. I'm your host, Enzo Quesada, and as always, I'm joined by my co-host, Bobby Hester.
Hello, everyone.
And this week for the show, for the Midweek show, I don't think this is going to be a long show necessarily, but we're going to be talking about something that isn't talked about very much in the media, but is actually a huge epidemic going on right now, and that is the opioid epidemic. Me and Bobby have been researching the last couple hours. I think we got a good show. Very concise on it. But with that said, let's get into it. So, what are opioids? Opioids are drugs that act on the nervous system to relieve pain. They interact with opioid receptors on nerve cells in the body and the brain. Opioids are a class of drugs that include illegal drugs such as heroin, synthetic opioids such as fentanyl, and pain relievers available legally by prescription such as Oxycontin, Vicodin, Percocets, codeine, morphine, among other drugs.
Yeah, and that's one of the biggest problems is as we go along here through the statistics, it's the prescription drugs that are causing a lot of the problem, that people are overdosing or misusing them.
More than the heroin.
Yes, more so than the heroin, but definitely not to ignore the heroin, because that is a very big problem as well. But that being said, that just segues into exactly how bad it is. Now, we have a lot of statistics that we're going to go through here, so we'll go slowly to make sure everything is read, and we'll describe each one as kind of how we get there, but for the most part, it's going to be a bang, 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 so let's get started. So, the first thing that we wanted to point out is that drug overdoses have become the leading cause of death of Americans under the age of 50, and are now 2/3 of those people came from opioid addiction. So, drugs in general are very, very bad, but as you can see, since 2/3 of those are from opioids, it is the prescription opioids that are leading to these problems.
It's more dangerous than car accidents at this point in the country.
It is, and we have one state that we're going to get to that's exactly true. So what actually kind of gave me the idea, I mean, we've been wanting to do this episode for a while, but what really kind of triggered it in my mind to say, like, let's go ahead and do it, I actually got a notification on my phone from CNN saying that a new report was out saying that U.S. heroin users jumped 135% since 2002, while heroin deaths have skyrocketed 533% in the same time frame. So this is a situation that's getting worse and worse every single year.
And you look at, like, historically different eras in terms of drugs and the war on drugs and whatnot. In the 80s, it was the crack epidemic. That was the big one. The opioids epidemic is several times larger than that was, worse, but several times less talked about. Yeah. And we've reported on the show a couple times about how dramatic it's gotten, but I think it does deserve its own focus.
Definitely so. And as we continue here, we're going to kind of go into some death statistics here. So, actually, I'm going to go through these. So, in 1999, there were 4,000 deaths in the U.S. Due to prescription opioid overdoses. In 2010, that number had increased 4 times to 16,000 deaths. In 2015, it over doubled to 33,000 deaths. And in 2016, it almost doubled again. 62,000 Americans died in 2016 from overdoses of opioids. Now, if you think about the math of that, that's more deaths in 1 year than the wars in Vietnam and Iraq combined.
That's crazy.
And it's getting almost no media attention at all. They said that a July 2017 report by the National Academy of Science said that there were an average of 91 overdose deaths a day in the United States. So this is a massive problem. And they also expect that in the next 10 years, 500,000 more people will die due to prescription opioid overdoses. And so we just wanted to lead with some of those overall death statistics. So you can
very
see
striking.
It's like it's doubling and it's just getting worse. But they said that in 2009, the abuse of prescription painkiller drugs accounted for more than 475,000 emergency room visits. This number represents a 2-fold increase in drug-related emergency room visits since 2005. And that was
We don't even know what it is today.
and that was 8 years ago. It had already doubled. So who knows how much.
If you look at it from the perspective of 2009 to 2010, when there were 16,000 visits and there was 475, you could imagine it's probably around 1 million at this point.
It's probably over 1 million.
Over 1 million.
I wouldn't be surprised if it's almost pushing 2 million. But in terms of like how this is affecting some age groups, in 2006, teenagers aged 12 to 17 were accounted for 1/3 of all new abusers. So that was 2006. All right, this is 11 years later. Now, teens abuse prescription drugs more than any drug except for marijuana, according to an Office of National Drug Control Policy's 2008 report titled Prescription for Danger. So we can already see, and this is from, a decade ago now, that teens are about 1/3 of all the people that are using this. And we have more statistics later on that are recent statistics that show that as well.
And teens are especially at risk for opioid addiction more so than adults.
Yeah.
Also women more so than men, but it's especially teens are vulnerable to opioid addiction.
Yeah, in terms of the women and the men, and we don't really have the exact statistic here, but it is kind of a generally believed thing that although women tend to use more, men tend to overdose and die more from it. But, like I said, that's not something we actually have a statistic for, but that is kind of a widely held.
Some of the stuff I've read have suggested these are the trends to it.
So, continuing on, we're going to name here some cities that have affected, or some cities that have been hit particularly bad before we move on. In Middletown, Ohio, overdose deaths have quadrupled since the year 2000. In Palm Beach County, Florida, overdose deaths have increased from 149 in 2012 to 588 in 2016. That's a 294% increase in 4 years. In Maryland, the state in general, nearly 2,000 people died of prescription overdoses in 2016. Delaware had 228 deaths in 2015 and 308 in 2016, a 35% increase. Now, the next state we're going to talk about is a state that we have a pretty big section here on, and that's West Virginia. And the reason why we want to focus on West Virginia is because West Virginia has been hit harder than any other state because of this.
You actually had like a good story on West Virginia, didn't you?
I did. I was trying to find it. I couldn't actually find it, but I do remember it. And that's regarding Walmart bathrooms. And as the story went, they said that there was this one particular Walmart in some town, I forget, in West Virginia, where they said that they were getting an average of about 2 or 3 people overdosing a night in the Walmart bathrooms.
Jesus.
To the point where, like, it was just becoming a health hazard for everybody that was working there. And this continued. I believe the reason I wasn't able to find that article is because it was from last year, is when I first remember reading it, before the election even. So we're talking like maybe even last summer is when I read this. Okay. So, trying to find an article from a year ago using key search terms.
When you don't remember the city either.
Yeah. It would have helped if I remembered the city, but just searching West Virginia Walmart bathroom overdose, you find just stuff that has nothing to do with that. But I specifically remember reading that story. Now, getting back to West Virginia as a whole, West Virginia currently leads the nation in overdose deaths per capita. They had about 41.5 cases per 100,000 people. Next up on the list is New Hampshire with 34.3, Kentucky with 29.9, and Ohio with 20.5. The U.S. average is about 16.3, keep in mind.
So more than double the average.
Exactly. And even Ohio with 20.5 compared to the U.S. average 16.3. That seems like it's pretty close, but when you remember that there are a lot of states that are hovering right around that 16.3 mark, Ohio is significantly above average if you look at it kind of on a scatter plot. Now, in West Virginia, 818 people died in 2016. That's up 13% from the 725 who died in 2015. So you can see that increased as well. They said as it currently stands, one person in West Virginia dies of a drug overdose every 10 hours. However, in the U.S., drug overdoses account for fewer than 2 of every 100 deaths. In West Virginia, that number is more than 3 out of every 100 deaths. And it gets even worse when you break it down by demographic. Among certain demographics, it is higher. 8% of all fatalities among white men aged 35 to 64 were drug overdoses or opioid overdoses. And of all white men aged 15 to 34, 28% of all deaths. Now that's including suicides, that's including murders, that's including accidental deaths, but 28% of all deaths among white men aged 15 to 34. So you can see that that is a lot higher among the young people, as you had mentioned earlier in the show, Enzo.
And also a higher trend amongst men for overdosing.
Right. And that's white men, too. It's, much, much higher. So now kind of taking a step back from West Virginia, we're going to look at not every single state here, but just a few statistics that we found that really stand out among certain states. So in Alabama, in 2012, they had more opioid prescriptions than they had people living in the state. That is a higher rate than any other state.
You remember on the Sunday show, we actually went over some counties in California where they had more prescriptions than people in the counties as well. There was something like 5 or so.
Yeah, and all those were in Northern California, or most of them were in Northern California.
Yeah.
Which tends to be more rural than, Southern and Central California as well.
Yeah.
And that's, as we've seen, is, it's rural areas that are being hit the hardest by this. But we'll go on later to describe exactly why that's the case. So next up we have, in Idaho, someone dies every 45 hours from an over-the-counter drug abuse. In Michigan, in 2014, 568 people died of opioid overdoses. 433 of those were heroin overdoses. So you can see that heroin alone made up a majority of the deaths in Michigan in 2014. In North Dakota, fatalities due to opioids increased 125% from 2013 to 2014. In New Hampshire, which, as I said, was the second highest rate per capita in the U.S., more than 13 million doses of opioids were dispensed from pharmacies in a single 3-month period back in 2015. So that's a lot, especially for a state that barely has 1 million people.
Doesn't have 1 million people.
Yeah. In Oregon, they said 3 people die each week of prescription opioid overdoses. In Rhode Island, from 2011 to 2015, overdose deaths rose 50%. In Texas, and I know we like to mention Texas because we live here, 4 of the nation's top 25 cities by per capita rate, not by total rate, but by per capita opioid abuse rate, are in the state of Texas.
Do you perchance know which cities those are?
That, unfortunately, I do not, because the article I had did not tell me.
Mm.
I wish I did know, and I should have had that. But in Virginia, 2 people die every day of prescription opioid or heroin overdoses. Now that sounds, if you remember when I said, in Virginia it's every 10 hours. So that's roughly 2 a day. In Virginia, it's 2 a day. But West Virginia's population is so much smaller than Virginia's population. That's why the rate is so much higher in West Virginia and it's being affected. So it's...
And they still average, even with a smaller population, 2 point something.
Exactly.
Higher than just Virginia itself.
Mm-hmm. A study that came out, now actually we're going to go now into kind of the economic cost of just how bad this is. So there was a study that was released in Pain magazine back in 2011 talking about the total cost to the economy in the form of lost earnings and employment. And by that it means like people not showing up to work due to this. Was $25.6 billion. Now that's 2011 when things weren't as bad. 2 years later, in 2013, a report was released by the CDC, that's the Center for Disease Control and Prevention, said that that number was estimated to be an economic loss of $78.5 billion a year. And that was in 2013, and stuff's doubled since then. So you can imagine that being close to $150 billion a year are lost in the economy from people abusing opioids.
Which is a very significant number.
Yes, very, very significant. So, in case you're wondering just how, the difference between like opioids and other abuse systems, 21 to 29% on average of patients prescribed opioids for chronic pains will end up abusing them. So that's like, 1/4 to 1/3 of people abuse the prescriptions that they're given. And we said that, New Hampshire had 13 million in 3 months back in 2015?
Yeah.
Imagine if nearly 3 in 10 of those people started to abuse them. Now you understand why their rate is so much higher as well. 8 to 12% of all opioid users will develop an opioid use disorder. 4 to 6% of people who misuse opioid prescriptions will transition to using heroin later on. 80% of the people who use heroin first misuse prescription opioids. So you can see that that really does go hand in hand for people that are abusing and then go on to heroin. It's vast majority.
Yeah.
People don't just start using heroin. They used it because of something else that they were using beforehand. And also, this is a statistic that I think you were shocked to even hear. 80% of the global opioid supply is consumed in the United States.
Yeah.
So this is well focused here in this country.
And also, just taking a step back to 80% of people who use heroin first misuse prescription opioids. It's people chasing after an even bigger high, because opioids will give you a sense of euphoria, and a lot of people, take prescription medication of opioids to get high. So when they're not satisfied, because as you get high, you develop a tolerance to it. That's when they transition to heroin, chasing the ever chasing or running away better high.
Yeah. So in 2002, 1 in 6 people that were prescribed drugs were given drugs that were more powerful than morphine. By 2012, that ratio doubled to 1 in 3. So even then, for people that are getting drugs, 1/3 of them are extremely powerful opioids that are leading to some of these addictions here. Between 1991 and 2011, painkiller prescriptions tripled from 76 million to 219 million per year. Now imagine if 1 in 3 of those people had opioids that were more powerful than morphine, and then 21 to 29% of those people end up abusing them, and then 4 to 6% of those people then go on to use heroin. Thousands and thousands of people. So as of 2016, more than 289 million prescriptions for opioids were written last year. 289 million. There's only 320 million people in the U.S. Now, obviously, some people got more than one, but you can see just how big that number is.
Yes.
Now, one of the things that we did kind of mention is how the overdose victims are mostly white and working class, and they tend to live in rural areas, or at least the rural areas are the ones that are hit the hardest. Now, we're going to segue here into what kind of caused this problem.
Yeah.
Now, one of the things that if you've noticed those numbers is they've really gotten bad in recent years, but when it really started to start getting bad was around 2007, 2008 time period. The reason why, and especially because it hit like Rust Belt states over there, is because of the financial crisis that happened. Now, those areas, especially the rural areas, were hit the hardest, and a lot of those people, developed depression or other things like that, and they turned to drugs such as prescription opioids and stuff like that in order to cope with those problems. And now that those people have been using those for so many years, and like you said, they're moving on to harder drugs, that's why in recent years especially, it has skyrocketed, just because as it gets used more people start using it in your area. And like we said, rural areas were the ones that were hit hardest by the economic recession that happened. And so those are the same areas that are being hit hardest by this because of that same reason. So the point that I was making was, as people use these things for years and years and years, that spreads throughout your society and increases the number of people using it. And that's why it's starting to double and triple in recent years as well. So with that being said, I'll move on to what you were going to continue after this.
Yeah, and that is what caused this epidemic. The biggest reason why this has gotten out of hand is doctors themselves prescribing opioid prescriptions. Doctors are prescribing opioids 4 times the rate they did 15 years ago. So there's been a massive uptick in them prescribing it. Dr. Jack End, president of the American College of Physicians, said the following: "The broken system of prescribing opioids stretches back to at least a decade and has its roots in the belief that pain should be considered a fifth vital sign, just as important as blood pressure, pulse, respiratory rate, and levels of oxygen saturation. If patients were not totally rid of their pain, that implied the physicians was not doing his or her job or really didn't care. That movement went way beyond proper medical care, so much so there has been a lot of overprescription of opioids for non-cancer pain. So we have seen a trend amongst doctors and physicians believing that their patients can't have any pain at all, to the point that they put them on these extremely addictive, extremely powerful medications when they oftentimes don't need something to that dosage. Now, an estimated 80% of prescription painkillers are prescribed by 20% of prescribers. So even though we've seen a massive uptick of people prescribing, as I said before, 4 times as many prescriptions have been given out as 15 years ago. It's coming from a small minority of prescribers. Now, who those individuals are, we don't know. But the majority of scripts come from primary care and internal medicine physicians. Very few pain prescribers originate from physician specialists. So, as I just said, we don't know who these people are necessarily, but we do know we're the source as far as who in the medical industry is doing this. Now, one thing that I don't know where this correlation comes from, but it was an interesting thing I found, is Medicaid enrollees receive pain prescriptions at twice the rate of non-Medicaid patients. Results from a Washington state study actually show Medicaid enrollees accounted for 45% of overdose fatalities in the state. So there is a trend, some sort of correlation between the healthcare that we provide to people on Medicaid and doctors that are prescribing more opioid prescriptions.
Well, I might be wrong on this, but it might be because some of those opioids are covered by Medicaid, whereas a lot of people's regular insurance does not cover them.
That could be the case.
That makes it easier for people on Medicaid to get them, because otherwise they'd have to pay for them themselves. That's at least what would come to my mind. Obviously, like I said, I could be wrong about that, but that seems like that might be the case.
Also, I just wanted to comment on heroin, since that's another opioid. We've seen between 2011 and 2015 an 80% increase in heroin seizures in the United States. Now, last week we had the 2017 Global Conflicts Report, and I reported that Mexico is 50% of our heroin supply into the United States. Now, I don't know how much is coming from Central America, but I'm guessing over half of the heroin in the United States is coming from south of the border. So I don't think it would completely get rid of the heroin trade, obviously, but stronger border patrolling and a wall would have an influence on that trade coming into the United States. That's a given.
Absolutely. And that's kind of a segue in to move on to the next section, which we have is what's actually being done to fix this problem. So we have examples from a couple of states in that in March of 2017, Delaware introduced bills to limit doctors' ability to overprescribe painkillers and improve access to treatment. So as we said, overprescription of painkillers is kind of causing this as well. So at least Delaware is realizing that they're trying to go after the doctor's ability to even do that in the first place. Also, in March of 2017, the governor of Maryland declared a state of emergency by increasing and speeding up coordination between state and local jurisdictions. I'm not exactly sure what that does precise, but it would definitely help. Now, this is the important part. In July 2017, the FDA, the Food and Drug Administration, cited the opioid crisis as their biggest crisis facing the United States right now from the FDA's standpoint. In August 10th, 2017, President Trump agreed with the CDC's report. CDC and the FDA kind of released that report to begin together. He agreed with the report and declared the country's opioid epidemic as a national emergency. So we are literally in a national emergency right now, officially. And if you look at the numbers, you can easily see why.
Yeah.
But going on, kind of going back to what we were saying about West Virginia, since they've been hit hardest. Now, this is something that's kind of depressing to think about. West Virginia has a budgeted plan to help families pay for funeral expenses. Now, this is like poor families pay for funeral expenses. They budget $2 million a year. When families apply, they get on average of about $1,250 to help pay for funeral expenses. So far, through June 30th of 2017, 1,508 burials have been submitted. They only have money for 63 more for the rest of the year. 1,508 through June 30th, only 63 more is what they have money for.
So they've already met that number,
Yeah.
most likely.
In 2014, that same budget ran out of money in June. In 2015, they ran out of money in March. So we're lucky that this year they lasted to about July. And so, even states aren't able to help pay for even basic funeral expenses for poor people, since poor people are being hit the hardest.
And a lot of that has to do with these increased uptick in deaths from opioids.
Right. So, Health and Human Services is focusing its efforts on 5 different priorities. Number 1, improving access to treatment and recovery services. Number 2, promoting use of overdose reversing drugs. Number 3, strengthening our understanding of the epidemic through better public health surveillance. Number 4, providing support for cutting-edge research on pain and addiction. And number 5, advancing better practices for pain management. So, as you said, pain management, when you noted earlier about the doctors who were trying to, as I said, pain was one of the 5 key tenets, right, Enzo?
Yes.
So, they already know that pain management is a big problem that's causing this crisis. And that's why they're trying to, make better practices to deal with that. Now, moving on, the National Institute of Health is partnering with partnering research with pharmaceutical companies and academic research centers across the country in order to develop the following 3 things. The first is safe, effective, non-addictive strategies to manage chronic pain, as we said before. Number 2 is new innovative medications and technologies to treat opioid use disorders. And number 3, improved overdose prevention and reversal interventions to save lives and support recovery. So it's good to know that, the federal government itself is noticing that this is a massive problem, and they're actively doing things in order to try to fix it. Problem is, it's just so big, and nothing's been done in the past few years. They're really trying to play catch up, and more people are going to die in the process before that's able to happen.
Yeah. So the last thing that we have here before we finish this show, like we said, this is going to be a shorter show than we've usually done for a midweek mini podcast.
Yeah, we're only about 28 minutes in right now.
Is some medical experts from the New York University have suggested some ways to avoid opioid addiction if you are going into a surgery, which I'm going to go over. Before surgery, you want to have a frank discussion with your doctor on the medication to be used for pain control. So, at least be cognizant if it is a powerful opioid or not. You want to create a plan, outline the expectations, including the amount of pain post-surgery. Look to taper off prescription pain medications with alternating them with non-steroidal anti-inflammatory drugs such as Motrin or Aleve, and also using ice on the affected areas. Also, they suggest in some instances using cooling machines to substitute ice. They also suggest that you share your medical history along with your previous and current smoking, drinking, and drug habits, because obviously that will play into what medication is best for you. Another thing they also say in terms of pain relief that you can look into as an alternative is acupuncture, which I don't know if I would do personally.
I don't think I would ever want to do that.
But, the alternative being addiction to opioids, maybe. I've actually used Vicodin before, but... Yeah, as you gotta state for a second, though, it doesn't mean just because you're using opioids you will get an addiction, or even that you don't even need it.
Right.
Just, it is a common thing where people get addicted to it.
And I'm kind of going to go back to read some of the statistics that I read earlier. is that, only 21 to 29% of the people who are prescribed opioids abuse them. And even then, only 8 to 12% of the people who do abuse them actually end up getting a disorder or addiction or something because of that. So looking at it that way, it is a very small percentage of a whole. But when you consider how many people are doing it to begin with, that's why the numbers are so big. So, I just wanted to interject that there.
No, of course. Going on with the things I was saying, though, you want to look to your doctor for a safe way to wean off prescription opioids. Just stopping cold turkey can also be very dangerous. Also, the longer you take your prescription opioids, you're at a greater risk of addiction. So you want to stick to what they prescribed you to. Do not take them longer than recommended. Also, just in terms of warning signs for addiction, if you're having problems with memory or trouble focusing, that might be due to opioid prescriptions. Also, if you're just having trouble keeping up with your daily tasks, such as going to work, which is why there's such a big number of, money lost from people not even being able to work because of opioid addictions. Another thing they recommend is to ask a friend or family member to keep you on track with your recovery and to understand what is your plan for pain medication so you can be held accountable, because a lot of people will be in denial about their medication, and that's where you get people continuing it past their prescribed amount or taking higher doses than there need to be because they still feel some sort of pain. And lastly, just the last thing that they recommend is dump any leftover pills. Don't leave yourself the potential of them even being there. Just get them out of your sight if you don't need them anymore.
Yeah, that would definitely be something that I think, I think that might honestly be one of the hardest, especially if someone has developed an addiction. Because if you even see pills left over, a lot of people might think that they still need to take them. And so that kind of plays back to what we were saying about overprescribing the drugs. Is if you do have any left over or you're given too many, people have a psychological thing where if the bottle isn't empty, they're going to want to use it.
And also, just thinking back to another thing I saw while we were looking this up, of people that illicitly misuse opioid prescriptions, 50% of those people get their medication that they're abusing through a friend or a family member. So even if you're not someone that wants to aid others in getting opioid medications, it doesn't mean that it's completely safe to continue to have them in the house, because someone could still, knowing that you have that medication, go into your house and take them from you.
But yeah, I guess with that being said, that's pretty much all we wanted to describe. Like we said, this is a pretty short show. We're only at about 33 minutes or whatnot. So do you have any final messages that you want to say, Enzo?
No, other than we still have the Sunday show, as always, coming up. Do you want to also, I guess, tease the big guest that we got coming on soon?
I think let's wait till Sunday to tease that.
Okay. We got a pretty big guest coming on to do a midweek mini podcast, probably next week.
Well, next week we're doing Hillary Planet podcast number 2.
You don't want to get the recording from Hillary?
I mean, we'll see. So,
okay.
Well,
so either
we won't spoil anything here.
We're either going to have the second episode of Hillary Planet podcast, which we've gotten some great feedback on the first one, or we're going to have this special guest that we'll reveal on Sunday. But yeah, I have nothing else to mention on the show, though.
I don't either, so.
So thank you for listening to another episode of Trump Republic Radio, and have a good one.
Bye, everybody.
Bye.